If you suffer of poor circulation in your lower limbs, it could be a condition which is called peripheral arterial disease, that is described as a buildup of cholesterol, fat or platelets in the inside of your arteries, which could eventually progress into narrowing the arteries to the point of a complete blockage, impairing the oxygenation to the tissues of your leg. Peripheral arterial disease may present with a wide range of symptoms and signs that can go from cramp-like pain in your calf when you walk certain distances, especially uphill or at a faster pace, which we call intermittent claudication. Interestingly enough, claudication comes from the name of the ancient Roman emperor Claudius, that reportedly he was limping. Peripheral arterial disease, especially in the most advanced stages of the disease, can actually present as a limb or life-threatening condition. And there are two scenarios that describes the urgency of this condition. One is called rest pain. That means you experiencing cramp-like pain even at rest, especially at night time, and you can't sleep without pain unless you hang your leg off the bed. And ultimately, in the most advanced scenario, you may develop ulceration in your leg that could progress into gangrene, and that could potentially lead to a risk of losing your leg or developing a life-threatening infection in your bloodstream. Peripheral arterial disease is actually a global pandemic that may affect up to 200 million people across the world. And the most advanced stages that we call critical limb ischemia may have an incidence of up to 1,000 new cases per million of population every year. That means that in a country like the United Kingdom, we may expect 60,000 new cases of limb-threatening ischemia every single year. When you come to see me, the first line of treatment will be to reach a correct diagnosis of your symptoms in order to identify if there is any blockages or narrowing in the main arteries of your leg. The first step of the diagnostic process will be to undergo an ultrasound duplex of the artery, where we can assess the flow and the circulation running down from your heart to your feet. If we identify a problem with your ultrasound, the next level of investigation will be to perform a fancy scan, which is called CT angiogram, where we will inject some dye in the veins and follow the dye with the X-ray, with the view of having a perfect imaging of the arteries, their anatomy, and the extent of the blockages in your arteries, so that we can appropriately plan the most correct treatment in your specific case. There are different ways of treating your arteries. There is the old-fashioned bypass surgery that can still be a very effective procedure, especially in young and fit patients that can tolerate general anesthetic and the complex long surgery. However, the modern technology is also allowing us to use a keyhole, minimally invasive technique. The standard keyhole procedure that we call endovascular treatment consists of using angioplasty and stent, which are wires and catheters with balloon that are inflated to stretch open the arteries at the level of the narrowing, and potentially using a stent like a metal scaffold to keep your arteries wide open. The caveat of endovascular procedure is, however, that the artery may need to be elastic and flexible enough to accommodate these metal stents, which is not always the case, unfortunately, because of aging, diabetes, smoking, and sometimes kidney disease. The artery becomes very stiffened and hard, and potentially they cannot tolerate the presence of a stent. But the good news is that we have recently developed a cutting-edge technology to try to avoid the use of stent even in the most blocked and stiffened, hard calcified arteries. And there are two specific techniques that we have implemented very recently, which are called the Atherectomy device and Intravascular Lithotripsy. The Atherectomy device is a mini drill catheter that goes through the blockage, debulking the main calcifications of your arteries and restoring the normal anatomy of the artery itself, and allows the blood flow to go through in a nice and smoothly way. And at the same time, this device has very useful suctions device that capture all the debris that are producing alongside this procedure. The second technology that has been very recently implemented, and at St. Thomas's Hospital we have used this device first in Europe, is to use a shockwave balloon. It's a very gentle 4-atmosphere balloon that produces sonic waves that, with the same technology that is being used to remove your kidney stones, is able to completely dissolve the calcium and the stiffness inside the wall of the artery. If you have symptoms of poor circulation, cramp-like pain when you walk or even at rest, and especially if you have developed an ulceration around your shin or your foot, it's paramount that you come and see me. And as your vascular surgeon, I will make sure that in a timely manner, within 2 weeks from your referrals, we will do all the investigations and, if necessary, proceed to a correct treatment to restore the blood supply to your foot and ultimately to improve the quality of your life and save the viability of your leg.